Focus, we introduce you to an 83-year-old veteran who was on a 3-month wait list to see his VA doctor. Now, we were able to get him help earlier, in an earlier appointment, and since that story, a number of you have reached out to our In Focus investigators with stories of unbearable wait times, backlogs, and what some call lack of care. One of them, the daughter of a 90-year-old World War II veteran.
Well, Jamie, it's not every day that you get to sit down with a World War II veteran, a true American hero, a soldier in the first wave of Army Rangers to hit the ground running in Normandy. But his story doesn't focus on his medals or the sacrifice overseas. His story is one of pain, a hero who says as he struggles waiting for care, he's watching an entirely new generations of veterans take a number to stand in line.
In November of that year, we finally came home.
Home, a small yellow house in central Maryland, adorned with American patriotism, a place far removed from the World War II battlefields.
From what I can understand, I'm supposedly the last one in the company.
D-Day 1944, 90-year-old James Wilderson was the first wave of soldiers on the ground in Normandy.
We attacked in Lauterbach, Germany. I was shot in the head by machine gun fire there.
He would be shot again, cared for, and returned to fight each time before the war ended.
You were there and you had good men with you. So it was like you were with your own brothers. So that's all I can say.
70 years later, he's home, suffering from a long list of health issues. But it's a battle of a different kind, a battle, he says, to get timely care at the VA.
This makes it very hard on me, all of this delay of backing up and waiting for records and people not making decisions.
In July, the former Army Ranger had unbearable pain in his foot.
When I called his primary, they had no openings for an urgent visit. Was advised to go to the emergency room, and that's when a lot of this started.
He waited 7 hours in the ER.
Once he got back, all the specialists were gone. It was 7 o'clock by the time he got back, so there wasn't anything they could do.
The next visit wasn't any better.
I was down there for 12 hours, and I told him I've got to go home now. I said I have to get rest.
One of the things he said to me was, "Do you think they're doing this because I'm old?" And I'm like, "Pop, I hope not."
Now, a month and a half and multiple phone calls later, his daughter Deborah says she's in the final stages of getting his foot taken care of. But she's doing it by going outside of the VA.
I just want to see his last days be comfortable. You know, I don't want to see him in pain, and that's why it's important to me to get him the help that he needs.
A true American hero, looking to not only handle the pain shooting through the same feet that once raced on the grounds of Normandy, but hoping to pave the way, seeing a lot of himself in younger soldiers waiting just like him.
You got a lot of people they got to take care of. I'll be going soon. But they've got a lot of young men coming home. That's it. That's about all I have to say.
Now, the VA cannot comment on specific cases because of patient privacy laws. They released a statement to us saying, in part, "We take allegations of lack of service very seriously. While we are proud of the many services we offer to Maryland's veterans, we recognize that there are always opportunities to improve or assist veterans in receiving their VA healthcare services." The VA asked me for Wilderson's name so that they could reach out and help on an individual basis. I spoke to Wilderson's daughter, Deborah, today. She says the VA did, in fact, call last week and again earlier this week, apologizing for what happened, blaming understaffing issues. She says until the VA is fixed, she's going to avoid bringing her father to their ER. The VA says any patient having problems can contact a patient advocate. They can be reached by calling 800-463-6295, extension 7099. We've put that number on our website. That's at abc2news.com/infocus. We've been asking the VA to do an on-camera interview with us for months. They have agreed to sit down with me next week.